مرقدر ادوارد رسل نمو دمو تلتال بدو سسرا يبدول مرقلاي مربوغول بيلاو بيلوم بيرقلاي مرمسيل بيلاو President Senate Hopkins Paulus marugul senators Speaker Anastasio marugul delegates Chief Justice Mirai Galau marugul justices Vice President mar ministers governors lators mar tugubets susurgidan mar other belau ngara ngayangal mor hotcherigi iregal tugubets susurgidan mor trigan dan ngara ikrela blur bela lela alsilis kida ultruga kriba se abodoru uringia igal press conference kida abodoru bi-weekly muriate ledel ukko agawut moklage rigi de mem kada adadu dirigal qora modegal sal gamal modura lele bay murusra urior mun sogal bay wata kida mo adres sel issues that were brought up in previous press conferences. The other board saying ngari ko ato sa announcement tel ukko solo ay sirgi da postmaster narak pasat te al mo klo ay sirgi da ore da post.
Palul tutao presidente ngaria malungil l'aisa sera abodunga post office sera march ra temlo mereka rak ntaragel togoil القدام لي صاد المقرني وشيء قدم غران هذا النار بلاوا ملمول ملول دروكلا يجيل نيا لو سبي الجير ما يجيل أمرني يجيل نيا سوري الجيل النار أمريكيل ما نامو بتوقع الجيل النار أمريكيل اتيال ملول موديكسل فلات ريت باكس يجيل غراب إلى الباكس البمغارة بوست أوفيس otto akloklu di bota aral el alsil se al sumo il durokra tru il bond 10 pound al klalo ra post office mo ngara dai time $97 aral me segui de presidente kada mlomring lo rol mutlo sikro lele sel flat rate so el mo available more other belau man sogal announce lo sea el almel الدوري فيرست السلمة مانديرا next week إن لموت الموارين سيجد الفلات ريت أجد الفلات ريت باكس الأفيلابل المو سبعة دول دروك لقلال يا أرالا سيجد الكونتا ترو البوند أمولو ليان إن $97 سيلباكس أمو سبعيني adi mo 99 se amal klo liga gidele discount al morar adrablu wa ese presidente gulnitra te ale di wa ise lo sea ngogi te gidel tretra omicron gida amo masabak lo ase kadam kara masabak te luror post office le kadam dingel lo ase البطوغ الأعظم مالو الطوير التالورورا بوست أوفيس مديال سبعيد الميسان المو منغسيم رأس مريل رأض التيا رأض اللورورا مو إنفكت ما جملارو ليا contingency plan مالو مغسا رأض اللورورا الأسل جيبيني مو تبلو التيم غاني سيجد السيف تيم مسيلين يانغار operation تيم من أكتي سوغلو نيترا كلورين رأض ربلو lo sea gelnia dulurol rulin man amre adamela adial sebe del mut el aldangar al selangal omicron akmalolnit lo sebol maklormiu edo lasmal dil ngaria uriora post office mal dil sebe del lol durok laklal mora ngalgedel ngara aikrel belau osisul time bol sedel dimel mol la amel ergide lagal pol ngaria time kamam rogu ngara post office mo exposed el mora point lo hacen ngire de close ra post office se gimalo rol ngire el seguide presidente lo hacen lagal happen unfortunately mutel tela dire lo aisa sen wal kodora di merre ergide atara ngalgeda amlo expose ra Red Cross se ula Red Cross amlo ngasim rasera Monday le taradara MHHS dilur tilo ase ndiagim test remu kom di mo isolate rogui mergo nga mande telmu tel mo omesla se tangara se ilmu tel mo openra seguida el teletale presidenta ta avoid ringi dial happen el mera a post office ma kimo mir gamamel mo tul team makti soka logi tagi del togo ase bol maklormut sel omera post office agim la mo require el mo limited ar adel metmur al sela front door ma tadi ngari trigel ngara waiting line al 6 feet ra al sel mergo gyol tur gamiu so bol maklor gamiu o me mar al sel amlimiu mergo ngi mom godor gamiu metmur al sela post office el minimize ra agagidele contact malu gado se de lo hace gado practice sel el igagidele social distancing requiring a Ministry of Health and Human Services. Ndiga gide presidenta gora sagalo ay so litra adrablu ang mamsulang.
Bean sulang Postmaster General agum da suet se mal important luktat kel morar bekra adrablu se lo hace tel togora tret ra covid de calzado del mo si sel ngara le del morabwai mang gira del plan accordingly mang akmero hasen de del post office may garo kol ministry sa diregal murura kora flexible schedule adjustable schedule ngara lire aureo ngara diga da murur segid mang de kal matroba service en morar adrablu se aklo tutel mang sulangal o ti sel program ramira post office diregal o se sel consequence rauk dilo bara Red Cross and the mlulu gire hopefully mande il mutel open aro gulto ke diregal sera last press conference em leklo agora gerel gire la togora WIOA engel director tao inmeli lamla da katselo mangel real tutaulen ngara conference call mangela US Department of Labor di gula me gunitra minister gidra finance logora di mo meskida update ngari written el الغامن تنيل غير لقل ملغر ميو مغادي تمو روسي لبون غميو سولا غابا مينستر.
Thank you, Mr. President, and good morning, everyone. As the President said, Executive Director Ngimri isn't able to be with us today. Hopefully, she can join us for our next press conference and answer any detailed questions that she hasn't provided in her report, which was received yesterday. My understanding is you'll be receiving a copy and you can review the report yourself, but I've highlighted a few points that she made in the report that you might be interested. In all, individuals who've received assistance through PUA and FPUC number about 1,600 people. So those are all people who have ever received assistance under this program in Palau. There's basically 1,200 current cases, and all of those cases have been paid as of January 6 to 7. If you recall at her last presentation, she discussed people that we call seasonal workers that they were reviewing cases for, and as of I believe it's January, January 6 and 7, 37 of those people were approved and were paid retroactively for the benefits under this program. 16 were determined ineligible and will be receiving letters from WIOA about that determination. There is also included in the report discussion about Social Security and healthcare fund deductions that were made. Under the program. As of December 21, as of December 1, 495 persons received the payment, altogether totaling $277,000. There are more people who had their claims deducted for Social Security and healthcare fund purposes. but there is apparently an issue of overpayments that was discovered in a review of the payments. And the payments will not, further payments will not be made until they continue their review of all of the deductions and determine whether there were any overpayments or not. So that's the highlights of her report, and she can answer any detailed questions the next time she's here before us. Thank you.
Zulang minister moisim lo dekat la director lo bangget ndi gedem lo blakatak pa sing ngari am legal question lgira la refund RSS mangari igel tilo 495 claimants angila 277,000 ndi ngari igel lolmol lo regadan lengari blol batigeri uksel US Department of Labor asing ngari adan ngila ududi lengala kraigel mlegiril malai mang maule tore kada gigil bebira ududir mang se emrala investigation ngi emrala review diril gira dal mamkat tlil wase ngari trigel mle batogol deset adra magit adra sers adra taxi nari gel claim tir tiga diril medan ngara ewal dar telat sel process and review I get claim tir emro mo issue notice wase either at wangeso amadu bendiak ongoing Sedro sengara ogi mal adam la a blood review 35 of them angila angeso ya 16 ablel notify til wase degan sil eligible ese process amal mol mong edaite dim na sokal chel wase aige nges lol bastrera mo walo mo ursel December 2020 27 2020 mol mutra September 4 2021 matrigege de determine angila average lui may miltela la tala gada mral dire galung tertala mrang asula la blue ramrigen they of course and get them understand was a program le benefit 1200 lat amlo stop la September 4 elage de msaw der trigel additional mula mo de angyaso el more trigger de adam no de gaurege semble endra September 4 ngari last payment til yo de explain mar adra blum dagal expect was ngari al mutu do del me dem namo set program am la end diregal so del diregal mal mutel te al you know garrogul tangat el mergida ngara rubak al diosen me gadamral ngal tangat tar salit salidra blue ram regal temral lobangge de program la WIA uktumura tokora covid and vaccine matimra CDC ngarter al time kadamara ngasulir malemre respond ngar belar al time of course Dr. Bostrom Dr. Thane timra asper dire mal mere ngasulir tigal togubetsel salidra angya sortir blura taiwan am la confirm as kogimera asabado e oltaga mask oltaga 10,000 test kit edirigal lo tatria toktanga manurs madralap me assist rigid hospital adamera ngasuli girel say unfortunately sel dirigal bladra ngasira taiwan selo medical referral program rigid cases rablur bela dirigal ngas taiwan dirigal ngas selo ngas against taiwan earlier in the week to lo isirgid rose our medical referral ma Taiwan bodo limit el mutel lon ngosongos latest news ako say hindi kailan dagi accept referral patients because at the reserve a space ra hospital til gira patients til mang gira ro mo focus sa centra patients gira mora huliping eleng sela simra wal gidam lo mara swar gira last el gora rise cases at Taiwan dibel shut off a flight altogether so hopefully tiadira ditlib and then they'll be able to resume and the akmadega sing close bakring adra blue girel say kida malmol mal orolo trigal salid di tegida di swadal el moduli emran mren asula rubakal diosera asel you know clying seuma abal tiger reng lo otiar bekla adar belal mura arbekla adar belal logio omrelli you know come será de tamaral kargik low mask el minister te kargik ngara distance magitil ngara press conference mal kada ngara distance ngara outside kada over the last couple days kada name sa ildo israrat el mora gym el mla mamala urus irtir. And you know one thing el mla uniform el konya Dr. Quarte, Dr. Roberts, Dr. Yano bo mga orsmim. And you know seluk de sarar adra blur bela tamral mungul rar toktang argi. Oise tirgegel el ditilo del mong di bo wise ase sera sel padra mande el girel trial ngalia del pediatric adimle 200 tori available orus el girera ngalia sera albong endimle sela sel siga em lokim the rogui leng mlengalak ra 200 tori adam le show up oise selung ilaisa sel kit ilaisa dimle yegi dam laring ngara ulen dimle yegi wel sera do otro murtial program makasar adal memla orsrir misal makasar adal memla orsrir makara amri ablu ramriyan hala don ngosong sera do maskami ulen dia mospe di seral me bol run out segi del hotel sales radar amrigela ase mata yor durok la 1400 legora gotulur oi se ngari sel flight tergi del mera Sunday night mangar segi del flight lo tagagi del lorus selbe so sel dos pa egal lorus le todo durok kalme mosi sel ting amle happen really sera dangara paden mlek engalak kara 500 rad almost 600 rad amle mala egel booster shot really dirgal di yadel tela la yegi del shot magdam sing di tela kebse ukmodia matamle announce el mergi dara trigal seri dara ambela se Monday dirgal mutelme dale la yegel orus digal continue dingari omurus ti mereka sulela segi del el klain se ora dron la dara blur belau edol mol marcel rul daso lo hace a helder yit angar ale aise e bai ko ate al pasa minister ma bai bol update yit dara what's happening ara uk atel situation e ruk to da bora minister jegin se mo aise dara school sila
Solange Mr. President malungit tutan marabeklat. Gel number selbok report gumda selbeklat di madengel intilov sel situation report tra kasus ra 9 PM. Aktimo melek lagi gida utakang al mangira kuk update tra kapsengay. So as of 9 PM ra kasus Tuesday January 18 nga 18 LBSL gays 148 tawal total active cases nga ra isolation. 0 hospitalizations hindi ka adal viewing real time ra COVID ul anya 19 al recovered malubot tamla release ra isolation 167 cumulative cases since August 20, 2021 direct sa daw ay sa el alsil sa makluku kung anya bebir tirigel cases el wabol day 10 or 10 sa edal expect the same number of recover del start del maral morbaber el ama next week. So lomes ay gigi del initial cases la mobreker sel 10-day isolation period 13. As of el alsils testing amal dir go reserve del more tirigel symptomatic with tirigel mle close contact tra previous cases early cases. Gida mangile gigi del test kits mesel bol available community testing agi mo announce the schedule ra basyo ma time. Osisil time visiting hours ra hospital remain suspended di nga niya adal nga ramadal hospital receive aklal si ira adra blulo label more tirgel newing el malmong sa del 6 PM mo 7 PM ra bekkel gopsingay osisil time abibira gel clinic sa gel regular clinic samla reduced malubom lamong atemel mayo teringi magidilingit tula sir ada dilo makadong ra OPD malub to ra toktang atil mala information na gelguk clinic atit direct sa dalaw ay sila sir kada muusap el COVID clinic malub triage site mo up and running mase saygi dia bodo speringil el triage malub kada message tirgel adal mail gora symptomatic mo sa edel lo message la se tirga positive case at di ngania toktang manurs mo evaluate tire o mesa sensi ildi mo self isolate tadang giril mo spea ugurul Sisilta mga nisel COVID-19 medical hotline el adi el alsil sa malumang kluku ken sa idal announce sel dengwa sel hotline ang boring medical provider el manner ngi en serang idit questioner adra bulul kora simbal girira la symptoms serti. President Tamnakbung luase kada mangilay kay gidil kuk shipment tra pediatric doses el mora 5 to 11 year olds and the booster adult tamalmol mora klukuk Moderna emerko el alsil sing available a Pfizer el mora 12 years old and older. Dili ka kapodo ready mo murus ra adolescent ra booster ding hopefully mo niya schedule sa gidil el kuk booster mo tirigel 12 and up el mlamma 2 dose. Direk ka sa dalaw ay sa eli kadulmo ra boosters ra homebound amlo sa edel murus ra 16 el homebound ese amalmol mer el alweek until the finish tirigel ro el homebound el require a booster. Ngora di kay git ya update sa el alsils ya kadol ngit la se do ngil mo sel kopsengay ra 6 mo sa edol tabdi sel update ra again numbers sa el ang ya situation report tablo ulto the 9 p.m. el kuk summarize sa gero guys ra daily. Tiso dala maklat keringi toko ra masking kakapsenge gil amo sel update ra kapsenge gimo telgibits mo dia toko ra mask how to wear a face mask properly. Dito kaklat kerigil sa igit may gigit preventive measures wa physical distancing ma hand washing direct kan mal bato ka question sa la self isolation ma self quarantine magi direct kan mo spare sa igit 6 p.m. update sa guk sma da gigit talang tangila a self isolation ma self quarantine di gigit kom sulang
Sulang. Ang mralo aseng leklo sebakreng ra parents magada understanding del segi del sebakreng ya dire kal understand ra challenge ra tora school al sumum tokar sensel de al si ilmol si sak ya dire kamle understand ra se tara gire del murungi ya gire del el flatten ra curve or reduce ra community spread kada war don ngosong sa community spread magada mlong al school tal sunday Gida miru legal decision, lultuir advisor expert sa labangget. Artoktang ang material mle dingar gida adra CDC. Magadamlo lultuir sa gida ako tuluro kadamlo ng school all week. Kadong maralo aseng lultuir sa gida luldaso. Adrutel tal Sunday. Kadong school, kadong mesenir after sa mong Minister Jenkins el mo explain lo sa melal lo la school kada makarang. Thank you, Minister.
Mr. President. Essentially, as the President told you, and as you may already know, classes at the MOE were suspended for 1 week this week, and that was, as was just said, to flatten the curve, to slow the spread of the virus. We are very fortunate that due to certain conditions, which we have been working on for several years, the teachers have been very well prepared for such an event. That although school buildings are closed, teaching and learning is continuing. And I'll just bring you a real brief rundown on how we're doing that for your information. We'll be starting at the high school level with Palau High School. Now, we already had begun a virtual lesson for the islands of Palau and Kayangal at the beginning of the month. And so they were already doing those classes virtually. Now, those were classes in the freshman, sophomore, and junior level. And also because of the initial rate of close contacts which were discovered at the school, many teachers took the initiative to get their online coursework going as well. So that was actually already underway. So what we had to do at the 9th grade level was or at the high school level, was to ensure all our hardware was up to par, which we have done, and everything's fine. We have a few extra tablets which we distributed for those which weren't working. And they've even instituted a morning wake-up call, so that they call the students in their class just to make sure they're awake and to get the class started, because we're trying to run the classes at the same time as they run in the normal schedule of the school. From the elementary divisions, it's a little bit more complicated, obviously, because there are more grades involved. The grades 1 and 2 throughout the elementary schools are basically using paper lesson packets, which are developed by the teachers, left in an area outside of the school office, usually, for them to be picked up and then dropped off. So there's very little contact in that way. They are, however, able to be accessed either by telephone or by internet by the parents or the students if they have questions. Many of the schools in Bubbled Up, the teachers are delivering the lessons to the homes because it's just easier for them to do that because of the size of the villages and the number of the students. The class grades 3 through 8 are also primarily working online now. Again, the same thing with, we use several different sources, the primary one probably being called EdModem, which is a widespread area site which enables people to chat, speak on the phone to each other, turn in papers, and give assignments. So it's basically a full service modem or online service. The use of that is also one which the teachers are very familiar of because we've had quite a bit of in-service on this area over the past years, and so they are familiar with it and comfortable with it. The basic issue we had was what were we going to do with our bandwidth, because we're increasing the number of students who are using this to over 2,000 students. Both public and private schools are getting this, are accessing this, these services. And we're happy to announce that PNCC has generously donated all free airtime to all students and teachers of the Ministry of Education, as long as this situation is under control. So no student is unable to access the internet unless it's a problem with reception. So we've identified a few of those cases, and we're trying to work on ways to get those set up so that every student who needs to access the teacher or the network that they're on should be able to do that. Those cards are going to be distributed today, and so there'll be full service available to continue the programs. Secondly, I would like to repeat everybody who's already said this, to urge parents to have their children in elementary grades 5 through 11. Please have them vaccinated. It's the best frontline defense against these diseases that seem to be coming at us. And finally, let you know that we have, by looking at the data, which the CDC has provided along with our own Ministry of Health and Human Services, we've decided to extend the closure of the school buildings next week, January 24th through the 28th, at which case we'll be getting more information and we'll be able to decide whether or not, when we'll be able to reopen the buildings for regular school attendance. Okay, thank you very much.
Go to Trail sa Korea Minister. School alsim ndi osis akla malmon. Gida mla mamudu ulos pertial melidiul mang malmol mo sisak logiwa melidiul. Magadi kaswesara computer screen gida throughout the years and Maria Angyeso. Albas kita gal baby rablul in terms of laptops, some tablets. Mang si el malmol ma osis ak logi utagi dal tretal minister ulai sroseng dire kam lari angya sol beskida PNCC el morarangal mar sensei man si el malmol tero osis ak utagi dal dangarin el maringal time mang ak bay di mokmui gigit bay masmuya te ala adra media mo ko gerager sulang kabong Mr. Clay.
Malungil tutor Presidenta, malungil tutor reklaat. Kaya kita kere ding takpo ko gero ko yung mustria alar baby lang atin ko sisiwa kadi. Ma ako te regarding still like vaccines el morar ngal pediatric from 5 to 11 hindi so ka-clarification na sisek kung dilasan di 230 il more celsius alam kung for that day divided and more coming days mensabi irarangal kal mo mala oras sa ilalsil sa luman na mo ti kay kem kumingi naman day.
Kira lay, hindi ka to clarify, hindi mle 235 al those sa dulap. Mong lamok niya, mlamo dia ka those al morarangal ka. Hindi kita na place order 1400 al doses. Hopefully sa Elmera Sunday. So sel kibo matingil sa man mero ingara ko to da schedule mora abululo sa ingaran sa iral tatirang ilgin mainding. Sa gidem le 235 al those sa dulap lamok niya. Will alsil sendi Pfizer mora 12 arkil morbab el first ma second dose.
Eka matyal ka re president wase mong eka gidal outbreak al dangar alser ilang. Ngaringi ako rapol impact ringi tiyale Maralmel Oceans Conference next month. Alubeng toko ako adir ka in the process hindi ka malamol maudior. Kira la murangira next month.
كده من قدوم كلا consultation رابلو رامريجل تملي advisory كده راسي مونغلي conference تملي expect ترتيان تميل سانغ راسي understanding رقمام تيان we can expect 6 to 8 weeks surge ممرك so asum قدوم قرا مورسل 6 to 8 weeks إنوال بالمدرا مارتش كده ملا بيجي تيان ملا مودي قدو ساعدني saya sel decision amle gora autuir seguidel duldaso gitiam la sois bradsel amdenga se ala endring legal baby rablu South Africa amla mesa Great Britain ma Spain angara umrole waise mamregel mundir kala mesing waise tel idea la close school it was something the lyrical blood practicing amrika lang lagi ngara school California ngara college Christmas break to sa di marti lang yala kome ngara online until January 28 so same concept trigger ngara break al durti lo sa kam halel tergi bang sulang
Alright, baldi last
Malaysia malmol ma conference hindi ka change si April.
Okay. Mal the last one kiba el mic over. Minister beginning al January na aldo do na se kon te do kam hasta tan ngari Omicron do ase ngara 10,000 al ata tir ka kal nga booster shot tir ma kom dilo ase possibly moria issue al sukum ta mostatal limit makal mera usisil time. We seem to see that, have seen that yesterday, malbatukal ata, they show up. Mangaringi, para plans sa ministry all time, mitigate tersegi del sar eli, el waseng makarata address at tergal ada sung temeraklugo kol mutan mo kamang lalain, mga tektal nga lalain, mutadirek create exposure mora for themselves.
Okay. Sulang elera malungil get. Kada understand lo sir ata ore den memala booster certi. Hindi kita dilmu tolo lingit tolo ase at sugum ko me pon maklorong view. Mola sa distance yourself. So sel tour al sel apa ta gel ginga lamal loobel. Marsayid tele la physical distancing. Da direct lo lingit tolo sel suguma ada symptomatic. Lakal pelora la orus longil mesel bol lakal Ngora maralang atel malung ngora pila symptoms sebel buul belolara booster. Nagil giramel mo o asana mutul babir adal ngora di mo metol ng sir sa gid crowd control. Malasam make sure ada talibal aroy di el time hindi ka ngora ngod al sa edel gut makli ang giret sa line. Kada ngelo sir ada mal di sorin may magdog takang al kay nga sew. Bol makloro ngud wasen sa edel mo marikat tegi del booster bere edel time hindi sa gidi kada di olingi track lay mo sera adal men was bol poda kay nga sewel sa edel mga sadra at elela raftel spreader sugum ngaring so rogul adal merapat giri lo mask follow sa gidi del physical distancing el sugum ka symptomatic mo ngin meselbo mo ngin lebe mo lara booster shot
di sokal edra sa eli aknara apad al sila bla mal ngula spacing ring. Even mga rik kung mesararo de tamal mungul sel gira del waseng gira del aro ya. Mga to lingi trado se won maklor ng mewe. Lakam kata lain ngarsel kado mungul rata matang. Ede do orang ara lain ing sodal lamak samria rado se me mo do torusol kami malakal. Of course ala na mo kamangalang we can only vaccinate so many people at a time. Hindi may malungil san sel the strain ngarsay soril malara booster at remember sel dangar outside dangarik kaya lang transmission is less likely mang kada hindi along masking even better alaro even better so kaya ang base elite temle practice mo kada man malungit sige kloreng ma umungul don mula tamatang sulang
Tuto President Pamalbekla. A question nga kamora Minister of Finance. So Minister, when the FY 2022 budget was put together, did we foresee the COVID situation that we are in now? And what's the impact of that? Is there any projection? How is it impacting our economy?
Thank you for the question. In preparation of the budget, we are always anticipating the impact of the pandemic in terms of the delay in the restarting of tourism in our economy. So we have taken a pessimistic view, and as you know, we appropriated 90% of the previous budget to continue to try to reserve as much as we can in case there is an additional delay in the recovery of the economy and our revenue stream. So yes, we've accommodated that, and we are continuing to identify resources in case the delay doesn't happen as expected this year, and we can continue into next year. So I think the last thing that we want to do is try to impact the government budget, because it is one of the few areas that is supporting our economy right now and people's livelihood. So we're trying not to impact that, and we're also trying to provide as much help as we can to the private sector. So as you know, we've extended the Cross-Act program by removing any date for deadline for this program. And we are working on revising the program to try to accommodate as many people as we can, including those people who are previously receiving assistance through the CARES Act and the Rescue America Plan. So those are currently being reviewed right now. We are also in discussion with the OEK. I believe they are receptive to providing additional funding to the program, and hopefully I'll be able to obtain some funding from other sources rather than tapping our reserves. That's the current plan and activity that's going on right now regarding the pandemic and the budget.
President, thank you, Minister. President, mention Taiwan last of our referral patients, surveillance mo. China Airlines hindi ka continue lo maral may that's one 2 hours. Sira last press conference gulo ay sa tangani 300 Taiwanese tourist mlapo kurtir merbelaw for the Chinese New Year. Ngari cancellation salo mandir ko sige do.
As of now, there ka cancellation. Of course, ito ka sa case numbers ay bala sa yang how risky is it to come to Palau. So hopefully they can cancel a flight confirmed them at 22nd, and beyond that then they go about of course it's up to them. One of the things is consistency is important. Plan and airline business is tough, and when China Airlines loses money they want to cancel flights. So kada trial help hopefully getting our case counts down, making people feel comfortable is important, so that they know that we're safe. So That's why require a cooperation ng Arbekla. Ito lang.
Minister Gapar. So since the start of the cases, increases of cases, is there an assessment on whether the closure of schools and other mitigation plans is actually helping containing the cases? And also, is there also a plan to look into the tourist arrival to bring back the 5-day quarantine to contain it? And also, I guess it has been said many times about masking up, the accepting the cases. But in summary, what's the priority to ensure that it's the cases, or it's gonna flatten the curve?
Thank you, Bernadette. So, with regards to 5-day quarantine, as you know, we're actually testing on day 4 for travelers coming in. Looking at the numbers of tests that we did for the last flight, there were no positive cases. Really, right now, I think our best interest is to protect ourselves from each other. The virus is already here, so it's a risk from not just travelers coming in, but also in the community. I think that's most important. Regarding school closures and the effectiveness, of course, we see that that's the reason why the decision was made to close the schools, because it's a potential high transmission area. But in terms of further lockdowns and restrictions, we have to understand that those were really designed for the Delta variant and previous variants. So right now, I'm not saying that our community mitigation plan is totally ineffective. Of course, we still follow it, especially with regards to hospitalizations. If we start seeing a lot of patients coming in that need to be hospitalized, which could essentially overwhelm our hospital, then that's when we have to look at further measures of reducing the number of people coming into the hospital. So it's a dynamic situation, so we keep monitoring everything, but I think for now we have to maintain what we have now. Of course, there's a possibility that things can change tomorrow, but for now, I think what we have in place is we'll have to do for now.
I think what the minister says is so important. We base the decisions on science, on data, on what the experts advise us. We're very fortunate to have very qualified local doctors, Dr. Yano, Dr. Corte, Dr. Roberts, and also the team from CDC, Dr. Mogol. That team is so important in helping us evaluate what is the best practices and how we mitigate and really control the spread of this virus. So things may change from one day to the next, but it's about managing that. One of the data very early on that CDC folks shared with us was in most other countries, 4% of the cases end up in hospitalization, right? And if 4% end up in hospitalizations, quickly the hospital is overrun. But as of today, no hospitalizations. So we're very blessed. But that's maybe partly because we have a very high vaccination rate. So we have to thank the people of Palau for being willing to get vaccinated. I mean, that's really when the community is working together. You have to thank the people of Palau for masking and protecting themselves. So, di mneso laway so seguida al bebira time en murege del gelo sing mungil dogarang school the closing ngara ura the closing ayegida again di gida ma iga rogol decision on the ministry authority experts gida mal tata the belal ngari mal matoko toktang argi Dr. Roberts, Dr. Yano, Dr. Corte madirigal trigal sedi dara amrigal sendra timra CDC mail dirigal ngase orgida Dr. Bima, Dr. Thane Ediragal lultu regi degi da mesra hospital regi da evaluate singara sel best the path forward mang. That's why kadamle our recommendation amle kadagil ngini kasi kami tolmul ra a school el telgip. Kadamle bagi crossing mol overwhelm ra hospital regi. Ele doctor ten ulai sigi da seral melo ase adome segal bebi rablu ngewal basen ra adal mutial covid al amora hospital. المو سبا الغرور hospital ela kadam lang alak radart ela ada ngutia ngoda expect to sengire ngari at least te telon mal mora te with radam namu ngar hospital kadam lang tangat indir ka kamur hospital diga da expect to seng eventually morning reng moise di te dira ka murgi da seng yedek te besen ngar hospital kadam manage se lo se kadam make sure inde kada overrun hospital maula baby ratam kadam motchen chapala sirgit el segida. Yeah, it's about management, containing, controlling, and make sure kada safe e protected ara da mang. Maran mena sulera trigal al expert tira ono sera ministry gidra a decision ser gidama agero gidam matmak girela abal wadam. Sula. Thank you, Bernadette, for the question. I just wanted to say it in Palauan because the Palauan audience also needs to know. Thank you.
Just a follow-up, Minister. So noticeably, there has been a long line in the vaccination center. There's a long line in the swab testing. And then you've mentioned about you're going to start community testing. There seems to be an issue in manpower. So how are you going to do all of this? Are you getting help from the US? And also, do you have who monitors those who are in quarantine? Are they in quarantine facilities? And yes, the manpower issue.
Yes. So, yes, of course, manpower is an issue with us. And so we're working with the NEC to identify which ministries can assist us with those tasks that don't require a clinician or a doctor or nurse. So they involve like testing, for example, as you mentioned. So we're working to put together a plan to recruit those workers from other ministries to come in and assist with those tasks. In terms of testing, we'll try to have multiple testing sites. If not, it'll be a centralized site and maybe just have limited hours or something in place to make sure that we have enough manpower to have all the tasks completed. But we'll have more details out as we plan this week, the rest of the week. But yes, manpower is always an issue, especially now that we have cases. We want to make sure that the healthcare providers are available to take care of the sick instead of being out there in the community doing tasks that can be done by non-clinical providers.
So I think some of the things that we've seen that have changed, right? For example, before when we used to do the testing, the actual nurse has to come and swab and do everything. We've changed that. You swab yourself. But maybe we need to move to the next level. You just take care of the test yourself and report. In the US, you've seen that Biden has announced they're going to give out 1 billion test kits, right? And I have relatives in the US that have told me what has happened. They got COVID, but how did they know they had COVID? Well, they felt symptoms. So they went to the drugstore, CVS, Walgreens, you pick up your test kit, you go home, you swab, you test, then you call the doctor and say, I'm positive. And the doctor says, stay home, wait 5 days, test again, let us know. That's it. So I think we need to help people understand that we need to help our health care providers. They cannot do everything for us. And that's what we need to move toward is we have the 10,000 kits coming from Taiwan. We have another 8,000 also arriving Thursday night. When we get those, I think, Minister, we're going to look at other ways of how we reduce that burden so that, the healthcare workers can concentrate on health issues that are really important. And I think Dr. Corte keeps on mentioning to us, why are we still testing? If it's just like the flu, then why are we even wasting efforts in testing? I think it's more of building confidence. People know, and I think for us to know how many cases are out there and how we can better manage and understand it. Mga damarad di mga sila Ministry of Health and umbral mring la ureri and many times ang tamo overburden dalang ngarege lurol asya de ligi del remul ding end up tiram rule gire mang kada ayni si mot makalon nga sertil make sure ngari additional staff and mulu lege lurol uktigal necessary other hospital amrul yakti dilli atukora testing lo ase abangara blu ram rigel abaydan amla announce asem momro sa 1 billion test kits, so they're going to be available online. You can go and order them. But something like that, dire kalam da soili girel belau. Alwase by ayay dan ngaria 8,000 test kit el mera kap singi raklu another 10,000 on sarude. Maybe the more sell point rase ngaramo ser demeng nur sa swabri gide la kadam namo de kad digid swabri gide ngwa swabri gide other si. Maybe namo ser digid lora Glasgow and sira gibong andi ko mamal test every day. So agigida namugida lo mesel look help para radra guru gida matmo concentrate ra guru le model masangara agidra ang matcha ko mo sanga positive ndeke well oy sebak rengar ka mal daw maralo sing to trail merdi kal mo test maybe sigida agida mururi help relief ra burden ra hospital mong sigidel klanya sera radra wala da close to trail and I think that will help the real ease ra burden ertina and that's why I say alsum ndekam feel symptoms ndekam feel ngarang maybe come close contact may please lakam rush them hospital at the test ka you know it overburdens them ra gel additional order tira maring tira ngat mo kalingia maral pai makau tu tren sulang
ngiltutan mega Mr. Presidente ma tegan ministers gulite boktore musulang Mr. Presidente mlaway sa tilal system ngani testing git lo magadoni kung flow flex sebem marara private strong rabluram digel yo spell ngi lege ngungila deira system tir men sebem lo mesa toktang temas yang almari ka laboratory mosel centralized system and todo mora CDC magmom dengay makangarabli me sebem madengay we hope abela ungil segid daira system ngi sebela o abela medical clinic laborala pa adin sebela hospital el momenti girngi klase tal ada smera cancer saal na dile adargya Mr. President ngani adra blue larong siya ministerio erbelau lo ay sik na setana overwhelm arada laurio larong sik na setana reduce our services ra hospital Diregal mlaw ay sergido klase beto kay gelon ngasong sa adra laurio mo hospital imorngi tirgel ngarahi mo dialysis samla mo dialysis irel el mo mala hemodialysis el alwi then dia ka needles tomal merenga sulem el gira decision el school am lolngul mang misteri rateli adra public health el motel gibel el ngani atte el lir lolngul el mulaureli togor olngi tuklase gelel sebem stobra skogi el merbela al sel el albuil radi el albuil Yatar on triram ni sori lo ni tra school lo ngul lo mut el mora endraman dingay kita minister sengin semla duli toli tok mobol sab eden misteri rakte al bolo ngul el wes hauleri el lutel subidi tok mo makaral lutel mo merula ureli el mo subril sob akli de terra te tamla me sa incident commander el mo makita ngul eswal mangal el girela low draurior el tiram rudnge tolmitok muglel sebedel mot stobas hogi el misteri rate al lolngul el wes aureli remergo de lut el mortial lurior loela
diang malungila greme Mr. Talams waigel tilo rawelen kida rogul decision al mega au tuira data or tuira a science or tuira consultation om tirar toktang ma expert regaluri mang selmo overwhelmed der hospital a sengar a leather rogui supporter tir mang for example teman mengalera wase mela kadru temamrula testra airport then kadamla approve dia kabel test kadam ruling mela kadamla ruli emne ase dia ngara help ring mutul stop sel test dia bodoruri lang additional work maybe seber krangara adra ablo ulo kadam ruling the science tells us wase it doesn't make sense so doktor bangilang overwhelm mara uror hospital unnecessary work akong tilal magidare lang already kada test ra adana tiar murtra community back to just testing hospital test tagel lagi kita dorul adjustment al help rigid من سدر تقول اوريو you know flights are important for many reasons one ngortagar adal mel lol nga seorgid oise ongero ngortakakar maigel gospel supply selme ongedeng you know kita ada dirgal soril melding arigid oise trigal baby rigid elasli dirgal luleng continue atokora tourist ng gare ding ngarangi ngari adal malur tuira geluryo you know just yesterday and I just shared this and nila si oras PNCC dila se mo give out agel free service and help para atokora education di amrari a PNCC if you look at their financial statements today they cannot continue to now dip into the reserves and bring it to survive with a cash flow why they are tourists say so what areas can you cut because an excel giram cut are employees namo de kango to kata salary tir kada makara dan namo de katse adal cut so gidam dengan wase stabra flight temnu to start three man maringen so ngara lev as leadership amot magi mesra arang lel belaw kadaman mongil malbodo ngara se adal ruling ngara se adal otur maulang mongar elela NEC eger rogul se help ra hospital alor tabra adal mo help perti kadire kal nangi tra se lid maula taiwan sendra adal me amrigla dire kal osikole sendra adal me dire kal mo help hospital ese awul kada se tiang ngar ele rogul kada makal mga tmokoni kodol mo seora ara hospital lon mo seora other tourists we have to help everybody government ta de kadilo mes tigal fi marte ngom mesara arngalen lablur bela e on mesara arbek la mang I know lo aseng mal close bakrenga hotel al understander seguid el sebakra tamatal adil mar mo wodal digam de sengra dire kan mal mring lol tagari adar hospital aigel mreda sel dengwa mamundal ngira adar abalu aigeda ulum ko motivo lol ngosangas tira dire kalsin mo concentrate already mung nga omral wase kados ke spera to korabel tigere dingari aparte sel dire kalgira dan mamruni mori omungul oise I think I got reminder mergi del wase for the practice aiga we base decisions science data most importantly omesrar ada wase tiang mara impacting morak mangarara mang man meringa sulela ati mergi del hospital ko temring lauryor emalang royal ege dire kal treatas unnecessary stress and mortive tira if anybody tira ko tergik ka hel maklangara ada bela dekal sorera imol ad al matamal na tial tokora covid mal wal bol sera gira tokora covid di kadam dengel wase tial covid am lame edi mer ko la banget se gira mo understanding if ngari au de swedro wase tia se den tiger ngir al sera blur bela dio dirulin modia agumda seng dekal sel tokoy lek dia mo blata kam adra blu adoru uringi mo understand wase ngo banget how do we manage it effectively and keep our people safe saya doruring help para take other belau mga kolitra leadership ablu belau say don't mall makaloror let's learn from the experts like we spent the 3 hours ra mayong experts am nos modin mergid hai Mr. Telam samal lebla tak doctor b am staba flight hindi ngaran nga swir tel mo sa dani lalal sils by cloth ngira mo malbodo cloth tel malel ang cloth nga swir nagida am saying why do we need flights ya das yegi mo malbodo o mesra alang lel belaw oise merkong sen ngara mo ale da rogo. That's why we say mask, distance, mklolondibl. And that's why I shared a story around together. You know, mo to pari mo kayo tell rak. Bodo, let's separate ourselves. Dr. Robert Sadri kamle maklat karigid. Mal somil helpel ra hospital mablu. Bro kala malam abu molup. Tey gaya dire kan malam kala. You know, aya part of responsibility rigid rogoy. Sel dungura obi sergid. Alsum kam net makalaulan sira before. You don't necessarily have to have lunch together. Maray gel say other practice kidel each individual will do our part. And I think sige daklaw tutrel. Alsum kida kaptigar mudara adam maadil marngaliyat kida gida murulang ele da rogoy. Unse eder continue telom roller. And sel goal gida say let's get back to school as soon as possible. The last till southern murunia ang gida lakan nga school. It takes partnership. It takes all of us working together. Sulang ra ager I hope mal sa masada igal flight. I hope kasi kita makataklin mo ra adra abululang. Giga dara bodo sa igal flight. I'm sorry. It's kadomes ra hel nanti kal economy ulo kadamay legal decision. Ya stress adiri kal tukara hel. Asela ka do dra ipengel man tukara hel. Lende ka do dra ipengel mo da ka tekera family ri mong malo because of stress. So let's look at the whole picture. Focus on the correct toy. Politics. We gotta get our politics. Focus on what's important. Because I blue ramriga ulit talma la time politics are multral set. Hindi ka dong mesra issue and how do we address it? Mataka mo ndara mask kasi ka dong mask, hindi ka dong mask, the vaccinate, hindi ka vaccinate. Ay kita da kalgira der murtring. Turur trawase ngara priority ngara uspera trablo. So, imok mo igem sulang ra age.
Sula, Mr. Presidente, tel geramura Ministerio Erbala. Agegidel deiral umpipra hospital. Girela COVID, magil baby rara. Agegidel ko statistics. Agekom share mora a CDC. Letial COVID-19 ablel declaring it international pandemic. Magil baby rara to lock cancer, my HIV. Agagidal deirara belaw kung direct sale mo ra CDC. So we will break down ng meet na saying ngaral ureis ngaral ada nosme belaw terbit tesale other gel belu.
Ang sulang Mr. Talams, why say daira ra COVID, ma daira ra igal bek padingela rat, ma report mo ra CDC, ma WHO. CDC tirigelo mosquita igal federal funds require gidel report. WHO ako tungura international health ingira del report. Of course agi collect igal data el amor nga te al sa el share mora media. Di el alta magi te adir gulmo el search makadukura so adal make sure la sa igal data el collect the report ang news pa el. Oy agi collect igay el asa el sila tal Sunday malubang irul Sunday sa eduguk moto da igel talgibel ko makail el details el gire la igal gay sa telar tirar saal telar tiral gay sa adra belaw ma adra ngod el bulu takir gel bulu ta vaccinated malubang dia igay del qura talgibel el ko makail am soda la sa eduguk mustat tel share sel doral obdula next week malubang following nding why say agi report taro ko mura tirakal federal partners sa mga international partners sa CDC, WHO.
Sula, Mr. Rama, sel redele bot sevemen seringira media. Derada direk sorin mom dengek mo. Tengrala da smer ngargel belu. Alube ngargel hamle tra sela belu pelam. Mr. President, tumle mention Biden el girela gel. El testing kits mo available. Abelur pelam mo eligible el girela gel testing kits. Betul testing kit available abelur Amerika. Ada dingar abliri dem namo sebril detail test kit. Makara agel abelur Amerika segidel la mot kadal mor abelur Amerika. Mor adra Amerika. Kito kata eligible mai gegidel ngeswa testing kit sem namo available.
Gora dirga katukon mergi to hasika eligible. Dik mo kasi namo sa online register mo. Come, tia naman tia other below. Kita zip code ram regel, so go in and try to register maybe sa elmay. Oh. So ngari set to bet hindi to ko diri kal bagi to sa eligible. Hindi kal stop bagi apply. So sum ko mo mora website. Go ahead and apply mesela sen sa elmen. Yeah.
Presidente, yung karam lamor around ra COVID, mandi ko ng street ka regular sa tidir nga COVID, hindi nga kaswakal mo ratara subject.
Yang malungin.
Tiyan mo meregal sante, apparently, Presidente ka, mlo mga adura la international media, el gire la belaw ma cryptic clubs, el gire la tial digital residency. Tial kadir kam na sa inga ringira, tial makatetal time. Mang todra online, maro kita adar belam lo o mesa ruriul. Agera wasi tiay gidel lem announcer ngi lo bangala cryptic clubs. El cryptic clubs sa adara mesing lo se gid yam la mangil tel mo registrar at digital residency. Is that how it is? How is the implementation of tial la in terms of promulgation of regulations?
Dang malungila karim sulang luk tia mo gera to kora COVID. Kita to ka gira mat mok le tia tara igella al gida un mesing na seng utala lela sensi belela udo de marabel wat. Mangwai se gida me sana sel molla ara endra December. Ulai ser other olbir sel time lo se triagida mo partner gida telurio. Godo lure del sani o tabdia uldasu. So about a week ago, sir sat the top the article saying Mlarian 9 different media companies el me gola ngal interview na. Maulo ko mesa igira matapto dra Facebook I had 9 different interviews among masader tel to digital residency lang sige ngaria interesting. We want to build that interest among the mga sulit trial mle masader niya. I think our first article lil sara tilov the lutto de Bernadette RNZ news. That was the first, but because of that article, we want to ask questions. Through Zoom, interview lo bantri. Magada mereka sulala medial. Kami ul direct lulu ay sarab lulu at matamos sa medial logger rigid. And that's really how we work together. Mereka sulala media for that side of it. Ya baik kung atel sa minister maluk pol help period explain say so the process going forward, where are we and how does that play out? Gira la regulations o tutel te aluro.
Thank you, Kambes, for this question on digital residency. The office is created under the Ministry of Finance. I have 2 employees of the ministry who are assigned to start the work for the digital residency. Yes, we have outsourced the responsibilities for the issuance of the IDs to a California company, and we're working with them on finalizing the arrangements to actually start issuing the IDs. There is some marketing work as well behind this, so I think we'll be able to share some of that marketing when we launch. I think it's significant. But you mentioned regulations. Regulations are one of the first tasks that we're performing. Writing the regulations that will govern the program. We expect to have a draft by this week, and then we hope to finalize as soon as possible. So the office is operational. We have people working in the office and working together with our partner to deliver this service. And this is one of those initiatives that we anticipated in this budget to come up with other ways to generate revenue that are not tied to tourism, do not involve having to physically be in Palau. The president's campaign, he mentioned this as a fintech. This is just one of several programs we're looking at right now. And we have a lot of partners we're working with, including other governments and other agencies like the Asian Development Bank, World Bank, IMF, who are trying to help us to do this in a safe way so that we can try to get as much benefit as we can safely with programs such as this. So I hope I answered your question.
just to follow up, Minister. So we can say that today you can apply to become a Palau digital resident.
My understanding is at this time you can apply to be sent an application to get into the program. We're still developing the program, and some of that is marketing related. But we expect that it should be done this month, provided everything is worked out and the details of this program.
So it was able to be announced before the end of the year. They already started taking reservations. That's what so they send collecting emails of people that are interested. And then the actual time when they start printing will be later, but they've already started collecting interest to be able to communicate with them and go through the process. One of the things that's unique about this digital residency, that the digital residency unlike a passport or a driver's license, I say, kasi ang mga criminal record ka ng driver's license, kasi ang criminal record ka ng passport, kasi ang money laundering yung passport ka. The under tialuk process rigi der amalar tial residency, because of the technology with cryptic labs and verifying information we're going to be KYC and AML compliant. That's knowing your customer and anti-money laundering. So ngala dang residency ri at sumang motmura yegi del toy pop up wasing involved by he's out. Seguida tial system le brada set up ri. Etiang mo ala orgi mang aygeluk pebi ratte ala rasyo by whether e-corporations coming later. Together ada plada verify through that system. Now we are together say okay nga legitimate la nga de kal involved by gal toy nga siya del approve in more together to. Crypto exchange. Together other more together crypto exchange adire one of the clouds in ngara the swira ada say tigal di mrula adal ngara crypto. No, the legitimate adal the other huchul other ablu asoril lambara crypto. Mugida ruli tiel ID rigida tiamo ito hingal chen moya sentanga angel kudung clean el sea moktegari mun sel involve by gagid activity edekal lolmal laigel lula blula tira da abi karim sea mal moktegen sigida open gagid mar gagid el baby ratte al whether in crypto exchange e-corporations and then eventually establishing our stable coin sea direct provider ratte al mergir almo control currency gida direct provider revenue marakabal mentor gida mang igakorat makal marahel kita continue lang gila oro lang gila olbil especially tigal ban mention tira a minister IMF ADB and meski da consultation maduro ni mukti kada tore tura imura uk mo complicate mo bang uk leader mo ring nagal gida mukti kada gida ndi maybe the simplest example or korak me was shipping registry I say dirga shipping registry gida amra mga revenue man mesois ngari abe bira challenge makada continue maswa kandi kada try follow best practices and sero abe bira do dol me ngasuira sangale dre al tam mal baaw ne de tourist en merabol wad mo sulang ra mo ilgere.
Mr. President and Minister, just follow up on the digital residency law. So cryptic labs will be the one performing security checks. And will there be periodic security review of digital residents? Is that part of the regulation? And also, 2.5 million is allocated to establish the office. So how many digital residents is provided in order to recover that initial allocation to establish the office or to recover that $2.5 million? And third question is, one of the services offered under the digital residency law is a name change. Doesn't that kind of a red flag, because it has been used in other experiences where nefarious individuals uses this system to change their identity? So how do we ensure that this is going to be not is not going to attract nefarious individuals.
Thank you, Bernadette, for more than one question. Let me take the name change first. The name change is to recognize some people do change their names. Let's say if you get married, you want to change your last name to your husband's name. That would be a name change that we need to process as part of the program. Of course, there is always checking going on. Every time we do something, there is a fee, first of all, and then there is also some work that goes behind the fee. That's what gets paid for, and that includes checking people's documentation to make sure the name change was done for the right reasons and not for nefarious reasons. And there are a lot of cases that we do have to watch out for, and there are a lot of technology that we use to make sure that we're not letting the wrong thing through the system. So the process of getting a digital ID is an annual process, so that itself is a self-check. So we get to check people every year. We are using a vendor to provide the service to us, but we do have regulations that they must follow. And all of the applications and issuance of residencies by the company are provided to us, to our office, and we have the data, and we can go through the data independently. We also have other self-checking mechanisms like requiring a certain type of bank accounts that our vendor uses, as well as requiring that these accounts be auditable, so we can conduct audit to make sure that we find any gaps in the system, catch anything that may need to be caught in the system. Regarding the amount of money, the way we set up the system, especially with the vendor, is that there is no cost to the government upfront. So the vendor bears all of the cost. When he starts issuing ID, we guarantee that we will get $100 for every digital residency that is issued. So that's how we have set up the program to the least cost to the Republic. Of course, the vendor needs to recapture the monies that he's invested, and that's something that we monitor. As soon as he collects his money, then we enter into a profit sharing arrangement. And that's how the agreement was structured with this company.
So I think some of the things we need to clarify is that in the law it said $100 goes to Palau, $50 goes to the vendor. It'll be soon advertised that there's another $49 on top of that. That really goes for the security and verification check, and then another $49 to deliver the actual card to the person. So it's kind of and those fees. For example, if the delivery charge doesn't cost you $49, the additional gets back to the government. I mean, we just charge it, but then, but if it doesn't cost that much to get it out, then some of that money comes back to the government. So there is opportunity for us to benefit more than the $100. Yeah, I think that's just what I wanted to add. Surang.
President, kada marmasoy sabara 2022 o meselo ase tegit tel ngaring tel outbreak al tangar al sere al time o meselo baseng last for another 6 weeks. Private sector ado meselo baseng al sab el ang continue nga o sisiwal position el blaring tel no mare kada may kaltablol el ngaria ke karel el increase en din dakal salmal mo o clol wise el blaring idam lo mare kada kal neptoga angeso el mlara national government tama direk kal ngeso el mlara WIOA el mora private business direk kal base rege report tra USDA graduate school kan mesala sa a private sector mal klo impact al moringil logi tel covid mang kadamangel wase anges ora cross acta malmol malmo march de ngaringi tigel ngar alsel el malaya angeso el moral la WIO am la stop ma akera wase Laringi sel resolution ra ulbi le gorga ul base bols emel mal gora blur amerika le muspe abe birege ludo tra compactal lol nga se ora private mal mol nga se private sector le tara mia press conference ka announce ra se di se mi ul access ringi anytime lo kiwa ongit mang agera wase ngaringi an sabela kabelmental mutel o mesal wase ngaral ngeso sa el extend el mora private sector al lolo mol mutra el arak ak madingela sa ko muktakar ka wa malasam el help para private sector mo wadi el modingil el lolki sringi hindi tiang ato me sringi hindi kalsa el makat mokal jadi el sel el arak makero say kanyangot al ngeso el mo mesel asa el mo el ngeso private sector.
So gida tara gida del momdalia tial COVID they can say the predictor say what's going to happen tomorrow. And I think I want to policy gida del mo mruria gida del diblo ngaria reserve gid. Gida say the say al time kada sel dungura togalon wa blada max out. And they can say the الموت الملالون. So gida o mese say gida ludo ngara compact lo say sel last reserve gid. Egire del mogori klase oi sedel di mrula yagi del program ang ding reality ayang ari atal gelel ngari endring and I think ablu ram rigel mumlom tiker segid ma ulang you know COVID mayang things must move on and I think gira del helper other ablu beral mo understand rose I know namu de kalsori reng sana kam logori we must learn to live with COVID. Dia بأس reality بأس الترتال ذكر على السر. mal mering kita mau accept ringi mau understand ringi. Di أقول لك دم vaccinate a protect ringi. أقول لك دم prepare hospital say أقول. So at the end of the day kita we've protected and made ourselves ready. Said imura kolere Mr. Telam sa malewila kumto sengel example analogy ra yakyu. Kadamlaren chew prepare ourselves. We're ready. Let's start playing the game and we can conquer this and we can move on. I think segida agira del helper other ablum yes maybe in the next few weeks ang motribel el mombre sa tokol mo hospital en brother sa atogol mergid di gira de sa destination agira di malmon ma omlola da gira di malmon kita ask other private sector say you know be creative asum ko restaurant meringra ga outside of air condition open amado move people outside we have to be creative but we have to keep businesses going so they can continue to earn a living and take care of other mang akmal ge ongela bagem luase sella ka dodor ipengela when he cannot take care of his family ese mar clol ser okay and mora health maklang raat kita agira mo understand luase a government au ulang aringi au tira tax ra adara belul tira mring lo so we also need to understand luase they need to be able to work to earn income al help ra abulur belang. We're all in this together. We gotta support each other. We gotta help each other. Nga omra wase in 2 weeks segida namo tribal mokira ul dasha del tel toy and we can move on. But do tagal dongalera radra abulur wase it's going to be difficult. Yes, will certo government mal limited. And that's why I'm left first the approach of government and has always been a helper to individual adam malakabol sangarenga. Make sure there's something for them and take care of families. Businesses, Waigel Black Share, are on reserves, mudega reserve, just like our study ng PNCC, al partra government rigidel, namonita trim and out they cannot no longer survive. So let's all help each other. Let's build our confidence. Let's share the positive news. Vaccinate. There are cases in our hospital lang. amoringi, but we can handle this. We can do this. This is important agira makaroon marunong. So, lang eh.
Sula,
Mr.
Mr. Presidente Amora, Ministro Ebelawi. Dindi soal share mereka Mr. Presidente. Ngani ada gudang li 14 years old. Ngani makita tel itu ta immune system ngi namo 5 years. Dilak nung orus. Mlamo COVID-19. As we speak. Hindi mo sisi abot ngel. Lo magal del 100, 405 April delel. Imlamo ngara 99, 98. Hindi ngara blat monitor nga tokta. Segi da technology minister. Available sa BML di ngara apply. Emergo giren ngani toktang available sa BML ngara ngara tengwa. Yang advice ka. Tiagi da gel merga minister. Ngani adal sorry nga assurance tirga angar omsil ke edal seberil nga omsil ke alwik tenda kan idel sorry nga assurance kung ay mo available mo tir roy ngarang selvel mention niya president mo to mo reduce ra medical referral ma Taiwan at sugum 5 hospital am natur da tigingele ekelel seber de lomesra ida hospital man sebel direct momlera medical referrals other pela. Di kay gitu.
Ang sulang Mr. Talams. Tuluula sa gidal ko ra concept ra adal COVID di ngarabli le monitor ra toktang. Ngora el altam hindi kalsal sa edal lulik tilang sa pela toktang al monitor ra adal ngarabli dit. Hindi mo niya hotline. We'll start off with a hotline sa pela adal goler ngi ko ra consult talawang gela either toktang malubin nurse al gela symptoms. Ulugo membran nga niya capacity sa pela roguil al positive di nga rabliri nga niya imol toktang al dedicated al mara imol at yung malungin di al time ada kal sa dugut maplit lang. So sa igit al dongot pok ring hotline at least ang gora te al sa ira adrabalul smer malubin di kal sa ira di bugik kal gela symptoms at sa pel golara sa igit al hotline ang mga dodura toktang malubin nurse. Sa tokora hemodialysis Mr. Talam sa mararingi diakal saldi yortial response ra COVID au ulno diak. Ida matingelo se gal no miracle racking blool mo problem. It's part of a bigger systemic problem al gida dal address diakal gatengel mo ringi gagi dal shortage ra. Diakal dil tokora hemodialysis direct kal tokora karma baby ra medical supply simong sa edal assure adrabalula se DL al week yung musa edal mo to start ra gel services sa hemodialysis ay gagi gel dol ko ulm direct kal maring rigida ko komes ra close sa skogi amo da kat TL ay gagi dil supply sel may mong kata amalas malguk marura tara to ko mo malamal ra tara to ko direct kal close to tulel ay gagi da pepi da decision sa gira marun din sa edal assure adrabalul wase DL ay gal maran mel club saying sa edal adal mutel mo umasil karahimo. Direct kal tara so adal ko raduli wasing sige the challenge kamamra ministry ang real alra ka wasing makarada sustain at tigi del COVID-19 response. At the same time ngania teme a manpower lomes sa gagi del routine and services sa mandiakal magim den bolu ula kuktara problem. Mong take it a step at a time and ding so dal assure adrabalul wase we're doing the best we can el balance the COVID response and make sure away gagi del critical services direct di remain in place. Ito lang.
Ngalungil sel pointer ko Mr. Talam sa kung muralo sa toktang albora ablay ang tang di telemedicine hindi ra kala urior. Sel di mo kodong kala dan me kadang mo do ringi and I think sige that's really the future. Mandi kada infect each other by the other dura dengwa kada makarra adamang. I think sila approach hospital gitu mandi kal top del mora ablu. Kamsadara tokora hemodialysis. Yung agira dan mora ulela atokoy. First of all, we really need to concentrate to clear our other NCD. Kita ulo kada mora hemo ngilter ka klela adol ara al sila badangit. Biblia mal blakatak mo sa tiat templo radios. Bodong at mokrin wa templo. Takadol tuay gel ngiya ule kada mo moraw gurula. Kada maran lang mo sangal di masada toro widem labes wase tial NCD whether ngomalam albu ngomange ang smoking ang mga law ang sukal ay rogul dol aral sa bangya dal al malmal lartel badangya de ule kada sangal ngaraw gurul giren. Ule kada dere kan madak tra covid kidem lam may garak. Let's concentrate ra yagidel maran maklaw to trail which is dol gabara adra se may got rungil to kore lang sel do Dr. Robert sa bal 2 weeks ukto ngali o malam albu mula ka dolo bila ka nga covid kala siya help ra adra se kala siya help sa program e kambe sila quit and win okay mo help ra adra and that's really what it's all about. It should be holistic to mesel tial health gidero gire and one of the challenges that we have at our hospital, yes, sometimes in more shorter supplies. And I know moswe one year and kadangal tanga flight tel mel otak. I say, that's why I said closer a flight. Mom lutri opening man meringan. We want consistent service. Mong meringan United and first flight rogordi. Dimla ka imol expense sa government terbelaw ito kordi a first flight. Dimla ka imol expense sa government terbelaw ito kordi a second flight. Digit selbodong itu gebuk podo sadara tir ito kasi madar somi a flight maharaw. Buk mo mawdo dergel mo olgi sa self flight. Se agoram ne tol ukara China airline. Somi a flight maharaw. Gida masong sa resource gida magida mo magkakanya sewe manage them properly. Actually sela sediri kal tal morter to kora NCD. Ulgum kada mo korgi kan mat mokla baget. Mo maksar gida mo dialysis, mo maksar gida hospitales. Ese tara ko technical expense ra kabelmen. Gida ulta badara almost 500,000 a year and more cell dialysis unit. Se sera 25 are patient ring. Ela tamlam mas and modori 7. Tara lolokoni hospital mena ase gida dorong ita dolbi ase increase ra budget. Then dire kam lamon masong sa ulen api or kama mamol stakaleng adimen der kama mamla mo cloning awana raw disera udo mugida girda al kainga seori dire kalo sisit time arada amos mere mora grudo spare service they refuse to hara le to sa government tagil di provide will be free well at gida mo understand was egal dollar al sila badangya o sa arid yung gida mo hospital maabur den tel imol al bulu ngada kainga sew betigar mo dertir mo dor tabda do del help pertir let's all help each other segid el tol dolorin a help der gaw a help der gid ang ale der rogu nadakal kainga se am help at tora NCD mal to kayel with program radio station man news and let's continue help rather abroad let's be responsible Mr. Minister agle dangar alet dire ka ayel dollar abel sela al sela badanya mangar alet
la molasta question ng korkawe minister Helda ang kmadinga katir ka mlo minister makal mera kara osange mara klungela aranglela hospital masada tel issue ra dialysis lakalwide president wipse yawan ra first tel tol milkat mok on turo bisa lakay nga sewlo to daw del arah mal tokol المسيرة dialysis in Mirbelaw. Remember ako na report lo say hindi kalingiro ko put into service ngaring igel nga standby in case nga niya matamal na igel baby ramasil. Mang tel concern kurang nga rabulul mel masada kay kita lo say hindi kalsabel ngaring dialysis lang hindi ka igel needles. I'm assuming that's a supply issue. Hindi ka sila kung tasang lauror ding supply issue. Mang understanding nga kakume sa igal report tara healthcare fund. Ang malbato ka palklaw ludo da tob tara healthcare fund insurance el mopera igal private clinics especially MSA ewal ke kare amor hospital mang Bolgula sa nga rin hospital, I'm sure ang receiver a close smear a blue vela recall clinics kaman. Ma-question awa say, ngaramang malga kare uto del mola ringira healthcare fund. Yalak alwi de se netara purpose ringil la amo on marura insurance ase mong mawati aktal close problem ra collection ma auto ra mental mo delay del mo affecta supplies. I guess a question following that say ngaraman dia ka supplies at this time ngara ko ra plan kami moving forward they'll make sure sugo mga auto del available el kira el mga lar hospital el ngay man pola kala mutal nga niya cost financial setback sir kami. Okay.
Kaman masulang ra malungin kere emeral tiga kabol talboy ra pok minister ilay gid baby ra close to talel issue suatal mo omes marko malas malisi mong tegi del tokora ahimol waigel tilol gukmura karila Mr. Talamseng it's part of a bigger problem el opmon da kada address ringi sa luul ing malamol maldi continue mong so ako ngito sa bol sila erul Sunday bol sa ekal mo mga dodoro kami ada media sa gido ko singedra amaran mel rakal gira la overall la kora direction malum plan ra Ministry ra Health ma Human Services la address sa gayidil el maklog to talel issue way get tilong a challenge sa kada malas mal balance sa tagil response sa COVID at the same time kada address sa gayidil issue direct sa kal announce sila sa nga niya team ra US Army Corps of Engineer nga terel ang lureli ra motmok ra root cause analysis ra hospital hindi ka di lomes ra tel infrastructure lo sing rang lito tul mangal sang sel te direct kalmo omes sa gagid ka karosel el system malum structure challenges el mauul mga niya gagid mong include at tokora ra biomed matokora maintenance mulmutra structure tel Ministry of Health and Human Services lo sing makarada realign ringil malasim makpayot ra tetela laurior mandakal boring niya gagid el delays ra mo affect ra critical services mang ako lingit ra sabay al sila erul Sunday al sugo mong kora mo talgibal mayus bol sa edel modong oklek ko oti sa igidal ko plan ra Ministry ra Health ma Human Services ra igal maran mel rak kasi included nga igidil mo omes ra to ra collection ma to alla le mararingi ul magi direct kalot la to ra services ma charges ra kar alot ra la alwaseng gire di opas el minimum lo kadol nga sir adrabalu mamlamas sa ara la dengi lamas sa ara la lu lamas sa ara la daily expenses sa raklangar and the services sa makar hospital di remain nilang ngarala basta direct luul man mol ngosong sa service lway di lu president la sa igel appropriation and mira services klol ga karera demand rel al time gide del moment sa sige sulang.
And I think part of that, I think Alicia, ang Arisel, la alblel, passing a Senate, umbasang lula, Dr. Quartel, Mr. Authority, more hospital. I think sel overall goal, kita sing namo kita Mr. Hospital, eventually more PPUC go private, so they can have more control and autonomy, more responsive, and more our patient response. Wow, hemodialysis unit among. Again, that's the overall goal. Or say, how do we get there? And I think sige del team I'm glad to hear they're here. Let's say para indo pay kami sem na una request and they came. So kada marang asulera da marigel na start the process. Dire kal ngari ngeson ngara hablo siabal nga tsendra technical expert rigid mel dire kal help para operation ma improve efficiency ma quality care hospital. And those are challenges that we have and the minister is on it. He's working on it. Mga maral marang asulera tiga partners rigid help rigid. Girel telur so CT scan girel cell base girel mera first part this year, so I think it's coming soon. MRI is toward the end of the year. Malpato construction namra hospital mo kung mesa kadiri kamara club building. The health is a priority and we're doing all we can, so they're on their way. Ara siya ba lamle promise ito kasi early part of the year kasi between now and June and CT scan they say between October and November and maybe in May sel MRI di ngiyad gut magla bat sure gid which is we're working on now. So lang. Okay, mlamo 12 o'clock. Oh. Etiam lagi di 1 hour el press conference el katangara COVID mundi ereng no tigi bel kamangal ndi ngil. Leng mal mo mlauna ngara mo dal mlaw kadang na masawda batokol direkal albang let rather belaw. Nsadro mo tertial direkal mal ngarang lungu. Nalen morengel ngel odam rigidel ngia amal of course ang immunocompromised em langwa COVID. Emlulu ulgrer tiga rogul ngelgel belal el langwa COVID hindi kada mga surat Dios el loma liustir el al time. Direkal mal mo malat kertigal uk baby rigid ngara tonga. Ser tol albu lertial volcano dirgam le erupt ma sel tsunami lulgi wulen. Kada mo dolat kertirang lungu el al time. Direkal suadal uk borang asulir tiga da government teblo bring lorel lolong ser gid rabe kalsil sera uk to bet sel sir tire for some reason tigid el sil sa uk qadim la qara mal betokal adel mel mal di imo and staff officer president el jolin ngolong ang so congratulations and morgaw gida mal el mutro mereng asuli war adra media ramal ungil discussion mesel meral mlam le betoka press conference in this past week Egumeser kami kom mal sertal do kole kom dime. Na dim laria imor sera sanden lo degi mom godong or kami mo kom awase ngaram dim lam godong digi direkal mungul wase direkal hospital war other hospital mo overwhelmed. Aise magada gainga se rogo indi ko imran mereng asuli ra information and provide mo other blue. Sel official press conference in 2 weeks and I'm sure mo time gira dala mo adura werse. Magi mo godong. Msulang.